So today's webinar is being presented by Dr. Reynolds, and I'll go ahead and let him do his brief introduction. Dr. Reynolds is an expert in this area. He is an amazing, again, presenter and really great at what he does. I had the honor to be able to work with him when I was doing prevention work on the local level, and I'm so excited that we get to continue this partnership and collaboration. So Dr. Reynolds, I'm going to go ahead and pass it over to you.
Well, thanks so much, Amber. I appreciate that very kind introduction. And it was great working with you on the local level and now here at a regional and really nationwide, because we got folks here from all over, from Florida, from Mississippi, from Texas, from New York, and across the country. So thank you all so much for sharing where you're from. Excited to have this conversation with you today. I'll just go ahead and share my screen, and we will be getting started here in just a moment. All right. So today our presentation is called Gathering Data to Tell Stories, or to tell your story, interviews, focus groups, and testimonials. And so this is the second part of a workshop series that's focusing on all kinds of things evaluation. And I kind of take a bit of a practical approach to that. You know, you don't always see the word testimonials in the word of evaluation, but I think they're a very valuable way to approach that. And so we're going to talk about those in addition to focus groups and interviews. Really today focusing on the type of qualitative information that you can gather that helps inform your work, improve your programs, and demonstrate your impact. For today, we have a toolkit available to you at commongooddata.com/storytelling. So you recognize from last time that we had a toolkit. And so so you're welcome to kind of use that toolkit. I'll just drop the link in the chat too to make it a little bit easier to click. So you can check it out there. It'll sometimes takes a minute or two to send it to you via email, and then it shows via Dropbox links. You'll be able to download the toolkit. It's basically like a 20-page toolkit that walks through everything that I'm going to talk about today. And so that way, that'll give you a great resource that's even got more detailed than the slides. That'll be helpful for you as you're thinking about doing qualitative research and evaluation work in the future. So a little bit about me, for those of you who don't know me, I'm a social worker by training. Been working about 12 years or so as in evaluation work and research, broadly speaking, in the past, since 2018 as a consultant. And do most of my work in substance use prevention, though I work in other areas too, mental health, case management, community practice, and other things like that as well. So trying to help nonprofits and public sector organizations manage their data and be able to report and demonstrate on the impact that they have. And I also teach part-time in the School of Social Work at Georgia State University. So that's a little bit about me. You can also learn more about some of the stuff and the approaches that I take, and hopefully these resources are useful for you on a podcast, commongooddata.com/podcast. You can find out more there. You can find it on Spotify, Apple, and the rest to hopefully get some episodes there that can be useful. And have one very recently that's actually just on this topic that came out yesterday. So as a reminder, the toolkit that I shared at the top of our presentation, you can find that again at commongooddata.com/storytelling. And then it will send you an email with a copy of this 20-page toolkit that will kind of walk you through all information on all things qualitative storytelling that can be useful for your work in prevention. Now, we've already done our introductions in the chat, so thank you all for sharing that. Our goal for today is going to be that by the end of the session, you're going to want to be able to describe key features of strong interviews, focus groups, and testimonials in the context of substance use prevention, though really a lot of what I'm talking about today is very applicable beyond that, but I do try to give examples from prevention to make it useful for you. And then in turn, also identify strategies for then collecting, analyzing, reporting on qualitative data, broadly speaking. And you'll find out as I do the presentation here, I absolutely love the chat. And so if you have questions on anything that I'm talking about, you don't have to wait. You can just drop it in there into that chat, and I'll do my best to kind of follow along as they come on through. So feel free to include your questions and your ideas and comments. And we're actually going to be using the chat quite a bit today as we move our way through. So let's begin by talking about why do we do qualitative or other narrative-based forms of data collection? Why interviews? Why focus groups? Why testimonials? Why are these things important when we are doing prevention work? And I want to give you kind of 4 reasons that I think that this is worth your time. First is that you want to know a bit more in depth about participant experiences in your programs or services. The people that you reach, you want to just understand more in detail about what's going on. Now, a lot of what you do in prevention is focused on quantitative types of approaches. How many people did you serve? and what was the score on the pre-post test, and how many people did you reach in that communications campaign? How many pounds of medication did you receive back during your take-back campaigns, right? So we're always thinking in terms of numbers. But those numbers only capture a piece of what you're doing, and they are not able to tell kind of a broader story. For that, you really need qualitative work to be able to help fill in those pieces and tell a narrative and a story that people can understand about your work. And that's kind of the big piece of it. So the second one there, you want to gather more contextual data, and is really important. And in this case, too, on the second bullet, I add here about your community via needs assessment. A lot of times qualitative work is really helpful because it allows you to gather information about things that you didn't see coming. When you design a survey, you have a certain set of questions. I want to know, what does 30-day use look like in the community? Or what, for example, are the rates of people's perceptions of risk around particular substances? You have your defined questions and you have defined answers and little bubbles. We've filled them all out before. But qualitative data allows you to provide a space for the community to share their ideas about what's going on in the community, irrespective of what your kind of initial thoughts or preconceived notions might be. So I find them really helpful for needs assessments. You also might want to use qualitative work to understand gaps in services and needs. A lot of times you get the information like, hey, the timing wasn't right, or I can't get there, and transportation issues, right? The communication was off. My experience wasn't that great. Any of that kind of stuff usually comes out in those qualitative feedback pieces. So that's a really useful reason for it too. And then also gathering testimonials for communicating your impact. And I think this is an area where we as a field in prevention, I think sometimes really could grow. Because we do, a lot of us, who are maybe funded by state or federal grants, we meet the reporting requirements for that, which often doesn't involve things like testimonials. And then we say like, all right, we're done. And you can say, I've completed my reporting, I've met the obligations of the grant, and I continue on with my work. But testimonials do a great job of reaching far beyond just that relationship between you and your funder to going on to your relationship between you and the community that you serve. To be able to show the impact of the work that you are doing in words and in means that most regular people who are not experts in prevention can understand. And so we'll talk about that a lot today. All right. So next, we have a fun little poll to get us started. And what I'd love to do is to get some feedback from you all about whether you have ever designed or conducted an interview, a focus group, or set up some type of process for collecting testimonials. Now, to answer this question, you can go to slido.com and then enter in that number and passcode. A little easier way is if you've got your phone on you, just hold your phone up to that QR code, and that will take you right to the poll where you can start to answer this question. Because I am really curious about how much you guys already know. And what's great is that some of you are going to come in as maybe experts who can share ideas in the chat with others, and some of you might come in saying, hey, I've never done this before. And both are great. We're going to have this presentation work for you no matter what happens here. So we got about 21 responses here. We got a few more coming in. Maybe I can show the results now. We can see them come in. Here we go. Okay, so 88% say they've done some type of interview before. About 58%, all right, say they've done a focus group, and just 20% saying testimonials. So that's really interesting, I think. And it speaks a little bit to what I talked to just a few slides back, that in prevention, we really focus on the top two and less so on the bottom one. And I think that really has to do with more about requirements of grants and things like that than it does have to do with necessarily need and mission for our organizations. So we'll be talking about that a little bit. Let's hear 46 responses, 47, 85% have done an interview before. I mean, actually, that's really great because you're going to bring so many of your own ideas and experiences. Maybe you can share some things not to do that you've learned along the way. That will be helpful for the group. And we'll be using the chat a lot today to kind of share some of those ideas so that those who are new to it or who are looking for ways to improve can get some other ideas from all of you experts who are out there in the field doing this work across the country. All right, so 51%, our numbers still stay right around the same. So about 4 in 5 have done an interview, but only about 1 in 5 have done testimonials. Very cool. All right, well, let's keep going here. Now, if you've ever conducted an interview or a focus group before, what did you learn? What did you learn? And can you share maybe just a sentence or two in the chat just to lift up some ideas as we get started? What were some things that come to mind when you think of focus groups and interviews, things that you've learned that you would definitely do again because you're like, hey, that totally worked. Maybe you want to include something in there like you would never do again because it totally did not work. Tips, anything like that, just to kind of get us started here about how you've approached interviews and focus groups in the past. So we got a couple in here. For focus groups, provide pizza. Yes, definitely bring food if you can, especially if you're working with youth. Food can be a big draw, and even if it's not a draw, it creates a welcoming environment. And that's so important when you're doing focus groups, because one of the key things we're going to talk about today is building rapport. And sometimes food can be a way to building that rapport and trust. Love that. Rose shares having 2 facilitators and an observer. I think that's a great idea. You know, when you're having an extra person in the room, and we'll talk about that a little bit too, it can really help. With one person being able to focus just on the questions and moderating, somebody else is opening the door, helping somebody find the bathroom, you know, getting things set up, handling consent forms if you're doing that, right? All of those things can be done by another person. So that's a great point, Rose. Excellent. Yeah, Emily says the same thing. I definitely need 2 facilitators. Excellent. Jada says the importance of simply listening. I think that's a great one, you know, is to walk into that space, and sometimes you think you have to do so much. And a lot of times you really don't. You can go in and have a great focus group and just ask 5 questions, and the group will talk for 90 minutes. So by just taking a step back sometimes as a facilitator, that can be a really important a way of doing that. Providing incentives or gift cards, excellent. We're going to talk about that a little bit. Thank you, Ida, in there. Silence as a motivator, excellent. Ooh, Madison says, remember to hit record on the voice recorder. We've all done it. Like, I've done it in Zoom meetings when I was supposed to record something and didn't, or walked into a meeting and you're like, oh, I can't believe I didn't record that. So have that on the top of your sheet. Sometimes you can just say, like, hit record before you start off, and have that second person in the room remind you as well. Patricia says that I learned that incentives aren't always enticing. I actually think that that is true too. And I still think in most cases we should still do them for a couple of reasons as a part of a broader package of providing an incentive to participate in a focus group. But you've all probably received an invitation to do something that included an incentive and probably turned it down. And it could be because you have time constraints or other factors, but I think a big one too is trust at the end of the day. Is do you actually trust and have a close relationship with the person who's asking you to participate or not? And I think sometimes we fool ourselves into thinking, hey, if we can just put incentives out there, that's going to solve all of our problems for recruitment. And it really doesn't, because if you don't have a trusted relationship with the community, it doesn't matter how much your incentives are, people still are not going to show up. Excellent. Identify barriers to participation in advance if you can help them, like childcare, parking costs, and bus fees. Great ideas. Excellent stuff here. Well, thank you all for your participation. We're going to keep moving forward here, but this gives a great idea. These are the types of themes we're going to talk about today. And if you have questions about these things, where you've tried it before and it didn't work out, or you're wrestling with some sort of challenge, drop that into the chat as well today. My goal is to be a resource for you all. Other people can also be a resource for you all, so you can walk away with a good toolkit in your hands to be able to go out and do this great work. Now, as we think a bit about storytelling, it's always important to keep in mind the strategic prevention framework. I think I talk about it every time I give a presentation because it's such a useful framework in terms of how you go about doing your work. And a lot of times in evaluation, we see it there at the end. We kind of think, oh, let's do our assessment first. We'll build some capacity. Then we'll do some planning and implementation work. And then, at the very end, we'll do some evaluation. And you'll see that this is a circle and not a line, which means that we're kind of doing all of them at once with maybe a bit of a focus on one area at one given time. And you can use these qualitative strategies like interviews and focus groups in your assessment phase when you're assessing what's going on in the community. You can use it in the capacity phase as you're asking questions to gather information about improving the capacity of your work. There are certainly ways to incorporate it in planning and implementation, especially if you're doing ongoing data collection, things like exit interviews after programs and things like that. And then, of course, certainly in evaluation. And I think that the key for this is just to think about what are the ways across the strategic prevention framework that you can integrate processes for evaluation. And if there's one thing that I hope that you walk away from this presentation, as well as the one I did previously, the first workshop, and I'll have one more coming up next week, is that building those processes internally makes it so much easier. If you have an existing way, hey, we always do interviews in this situation, and here's our protocol, we're going to do them again, right? And we've got it all written up, and we can do it each time. When you build that capacity and those habits, it becomes much easier. And you're not scrambling at the last minute saying, oh no, I've got a grant report due in a week and I need to do some interviews or get some data. We want to avoid that situation so you're well prepared to handle all those requirements as they arise. All right, so excellent. All right, so let's keep on moving forward here. So we've got, I've got some good questions in here too. Jason says, we're working with college students how to get participants who agree to participate in a virtual focus group to actually turn on their cameras and participate. That's a good one. And certainly we have these kind of changing mores around that. I think that you can do your virtual ones, and sometimes you might, if something, having that person in person and seeing that face and building that relationship is important to you, sometimes we might have to say that virtual isn't the best option. That's another way too, because if they're in person, it creates a different environment. And so, but we'll talk about that too. So I'm glad you brought that up around doing virtual focus groups in our new world, right? Planning and designing focus groups. So let's talk a little bit about asking great questions, which is where you want to begin when you start doing qualitative work. Now, when I say start with questions, there's really kind of two types of questions you want to be thinking about. One is going to be your broad evaluation, or what you might call a research question, which is sort of the overall kind of question you want to use to guide your work. And then the second type are going to be specific interview or focus group questions that you're actually going to ask people. And those are two different things. The first one's going to be more broad, the second certainly more specific. So I have examples here. So for example, if you had a broad evaluation or research question, it might be, for example, what barriers do parents face when they're talking to their children about alcohol use? What is it that keeps them from having that conversation? When they're about ready to, they're thinking about it, and it doesn't come out. And that's a broad question, but you can get at that through a lot of different ways. And so here's an example of a question you might ask in an interview or focus group. You can say, hey, you're talking to some parents, describe conversations you've had with your child about alcohol, and how did it feel? You might even start with removing alcohol there, just saying, describe conversations you've had with your child about any sensitive topic or any difficult topic. What did it feel like? That can kind of get at some of those motivations, right? Now, the reason I start with this is because we're going to do some exercises thinking about some of these questions, and I want to make sure that we distinguish between these two so that we have a good sense of what that looks like. Okay. So in the chat, let's drop in here some ideas. What are some examples of qualitative evaluation questions you've asked before and what we're trying to find out? And maybe we'll stick with the example of the first one, or the broad evaluation questions. What are the types of things that you have wanted to find out? And kind of how have you approached that? Because it would be great to see what people are doing across the country. What questions are they interested in that take them down the path of doing interviews or focus groups or testimonials? So drop some of those ideas into the chat. Examples of qualitative evaluation questions you've asked before. One that I'll add in there just to kind of kick us off is that we were doing some qualitative interviews of key informants for this one project that I was working on, and we were really interested in where there were gaps in services. And so the question was, how can we understand better about where there are gaps in services in the behavioral health space, and where do you see as the biggest need? So that was kind of a useful one. Let's see what else is coming up here in the chat. Okay, one says, what resources could we offer to better help our parents and the youth that we are serving? Hey, that's real great, right? So if you want to get a sense of what services you could offer, maybe you could ask parents resources they already have, or maybe resources that they think that they might need, or areas where they think of growth that they might see in their space. That's great. Danielle shares what perceived norms do college students have around substance use? That's an excellent one, right? What are the norms? And the reason why that's so important, I think, in a qualitative perspective, is to see how often those norms change in subtle ways. What substance use looks like now versus 10 years ago versus 20 years ago, it's very different. And so being on top of those changes over time could be so important. What do you think are the biggest problems? That's a great question too. And having that perspective come from the participant is so critical, because a lot of times we have our own perception as professionals about what problems are in the community, but they're oftentimes used or talked about very differently at a local level by parents. We can talk about and say, hey, I'm really concerned about a lot of the intervening factors that may give rise to substance use in a particular community, but no human being who's not a prevention person would ever say that, right? They might say something like, I'm struggling talking with my child about X, Y, Z thing, or, I'm concerned about what's going on at the school, or, after practice, we have this, ritual that I feel like causes challenges around, mental health or substance use questions, right? So that's kind of a good way to be thinking about, asking questions in a way that allow to hear it from the participant's perspective. How would they describe that problem? And recognizing that it's often very different than what we would do. What perceptions of risk and harm do parents have? Excellent, very good. What is the relationship between peer influence and high risk behavior? Yeah, that's good. That's a good, kind of that broad research question. Excellent. And when you're looking at relationships, we're starting to ask kind of that question. It gets into causality a little bit. So you could imagine some quantitative approaches that might be good for that one too. But I think you can get some great qualitative responses from you to talk a little bit about their perceptions of peer influence, right? Do they feel as, college students, do they feel as though that they are in environments that are conducive to or that encourage risky behaviors, and hearing how they talk about that can be really helpful as you decide build strategies for alternative activities or other types of prevention strategies, right? So these are all great examples. So thank you all so much for sharing some of those. These are all kind of the types of questions you can be asking as a qualitative person, or sorry, qualitative-minded evaluator or practitioner. Now, in the first workshop that we did last week, we talked a little bit, or sorry, 2 weeks ago, we talked a little bit about logic models. And many of you have probably done a logic model before in some formats. You can envision logic models at a large community level where you're trying to bring about community or population level change in a particular outcome or indicator. And then we also have logic models at a much more narrow level, like just a particular program. And if you go actually to commongoodData.com/simple, you'll see there's a posting there where you can download the logic model guide that I had and all the resources from last week, which you can refer to. But I wanted to bring up the topic of logic models here when we're talking about qualitative work, because logic models should be guiding some of our research questions. Ultimately, when we understand if we're trying to evaluate a program and we want to understand how to do that, the logic model tells us how the program works, and it gives us ideas about where we can intervene with questions, qualitative questions, to better understand how that process works, right? So I gave this example in the last presentation, and here's a program level kind of example of activities, outputs, and short and long-term outcomes for a anti-vaping program. So maybe it's this 4-week anti-vaping curriculum that's done during health classes, maybe something like Avoid or something similar. You could envision hosting guest speakers, facilitating role plays, and distributing materials. These would be all the activities to say, hey, we're going to address the challenge of vaping in a middle or high school setting. And you can imagine here we've got our outputs and outcomes that are all described as quantitative. So quantitative outputs like the number of classes you've delivered, the number of students who've completed a program, the number of educational materials distributed. And then you've got our outcomes here: increased student knowledge, improved student ability to identify and resist peer pressure, increasing the perception that vaping is harmful, all of these types of things. And then you have these long-term outcomes, right? So these delayed initiation of vaping behaviors, reduction in this percentage of students who report having vaped as measured by annual surveys. And you've done something like this before, probably, with a logic model. But you'll see here that there's a focus almost entirely on the quantitative outcome indicators that are associated with this program. So then the question comes, where does qualitative fit within this logic model framework that we're often kind of asked to follow, particularly for those of you who are funded by federal and state grants? And this is where you get creative. And so what I've done here to the logic model is to start to ask questions that are associated with each of these different areas of the logic model. So up here under activities, we have this 4-week vaping prevention curriculum. A good qualitative question might ask, what was the student and facilitator experience like in the program? Did they enjoy it? What were the sections that they liked the most and why? Did the facilitator feel as though the students were engaged? Why or why not? All those types of questions you can ask in a qualitative setting. In your outputs here, we have information about educational materials. We can ask in qualitative sections, how do you perceive the messages or fact sheets about vaping? And we might say that it's been very successful. We passed out, 200 great fact sheets about a particular substance. It may be that the information on that was not very helpful or convincing to youth, or maybe they didn't think it was very engaging. And so sometimes qualitative processes can allow us to get the feedback that we need as professionals to understand whether what we're doing is really landing with our audience. Up here, I've got a question: which activities did you find convincing regarding harms of vaping? So if we say that we know that we increase perceptions of harm in a particular program, well, what was it? What was it? Was it in week 2 or 3 or 4? Which particular sessions? Maybe he says, oh, it was that one time when the facilitator was talking about this or shared this story or gave this example. And that then it provides information for the facilitator to know, what are the things that are working and are probably most effective at reaching these different outcomes. And at the end here, how do you perceive changes in culture around vaping at their school? When it comes to culture, qualitative work is so important, and that's such a richness and a depthness that is often missed in quantitative research or evaluation. And so, you have that qualitative can even be really impactful at the long-term outcome indicators. So I share this here so that we've got good examples of how the different types of questions you can ask across your logic model. And so that next time when you do your logic model and you're trying to build out your evaluation process, think about your logic model and go back to those quantitative indicators and say, what are those things that you would like to know more about? And if you can't answer them through some type of survey or other type of quantitative approach, then how can you do that in maybe a more qualitative approach through a focus group or an interview? All right. So then we have the qualitative evaluation approaches. How might we actually do the qualitative evaluation work? How do you choose, right? So I've proposed in this workshop that we can kind of focus on 3 of them: interviews and focus groups and testimonials. And we'll talk a little bit about each one of those 3 and how you might use them and what you might use them for. Why would one be more useful than another? So first, for interviews, the question you kind of want to ask is are you trying to understand, or I'm just giving an example here, are you trying to understand why middle school students are experimenting with vaping despite prevention strategy campaigns? An interview with a small number of participants may provide that rich insight that a survey cannot. So interviews, I like to think of as like, where's the richness, right? The depth. How can you have an extended conversation with someone who can support and help you figure some of those things out, right? The interviews add that depth, and that sometimes we use the term thick description in qualitative research can come out through those interviews. For focus groups, here is where you kind of have the same, they're similar to interviews in a lot of ways, but what focus groups allow you to do is to bring in a mix of different people who can do, I think, a couple of things: surfacing shared experiences. Confirming that when someone's experience is like, hey, I had this experience, and someone else will say, yeah, I had that too, or yeah, I had that too, or someone else will say, I disagree, I had a totally different experience. And when you have everybody together, you can sometimes get a different type of understanding of how things, how people's understanding and shared understanding and meaning of their participation. We as human beings sometimes think out our ideas in groups. We're social people, and sometimes we need other people around us to kind of help us think, oh, okay, oh yeah, what about that? Or, oh, that just made me think of this. And focus groups allow for that type of dynamic conversation among participants, that rise or lift up these shared experiences and common challenges, and oftentimes creative ideas as well. Another thing with focus groups that I think is really helpful is that you do get to reach more people in focus groups. So if you do 9 interviews, you reach 9 people. If you do 9 focus groups, you could reach 60 people, 70 people. And so it allows you to include more voices into that qualitative conversation that you might not be able to do through interviews. So that can be really helpful. And especially if you're doing things like that are more population-wide, things like community needs assessments, for example, or trying to get understanding of the particular culture of substance use in your community or in your local middle and high school. Sometimes focus groups can be better because you get more voices in the room. So there's not just a handful of individuals who might be dominating that conversation. But at the same time, the more people you invite in, the less you get from each person, the less depth that you might have from an individual person. So if you really are looking for the depth of experience, interviews is the way to go. Interviews also, and we'll talk about this in a bit, can be useful for when you're looking at key informants. So people who have specific knowledge or experience around a particular issue in your community, interviews can be really helpful as well. Then, at the very end, we have these testimonials, right? So testimonials are totally different from focus groups and interviews because focus groups and interviews are kind of like these structured ways of gathering information to answer some type of research or evaluation question. Testimonials are really about having participants of your programs and services and activities be able to share about how the program made a difference in their lives in some meaningful way. And that's not to say that that isn't going to be able to answer some evaluation questions. It will. But it's ultimately about people trying to provide. The goal of focus groups and interviews is generating knowledge around a particular topic to inform your practice. The goal of testimonials typically is to provide social validation for the work that you're doing that then in turn encourages others to participate. So you have different goals set up with those two things. And so that's where their testimonials is really more about getting that sense of social validation in your community. When other youth who have gone through your program say, I loved it, it was great, it then provides the social validation so that other youth might join. Same thing for parents, practitioners, community members as well. Okay, so let's talk a little bit then about some of our qualitative evaluation approaches. We're going to walk through the interviews, focus groups, and testimonials, and kind of walk through examples of each and how you might use them in your practice. Okay. Sorry, we kind of, oh yeah, let's talk about from the design perspective here. That's what, I got lost in my slide to make it for a minute here. So program evaluation designs, I shared what each of these three are. Here's where I think they're most useful. Interviews, most useful for the in-depth exploration of experiences of participants, of key informants, of practitioners, people who have some deep knowledge of the work that you're doing and that deep knowledge is important to answering some type of question you may have. Focus groups, really more about group norms, shared experiences, brainstorming ideas together. I think they're often used as well with community health assessments or other needs assessments as well. So you can kind of use focus groups to, again, gather information from a large group of people. And the testimonials should be brief, personal stories that illustrate impact. And I have a star logo there because you've all probably been asked to do some type of rating or testimonial for maybe a product you purchased or a service that you purchased at some point in your life. Rate us on Google, 5 stars, right? That's the type of thing that you would imagine for a testimonial. Now, the key with qualitative research to keep in mind as well is that we're trying to build this sense of understanding, the sense of depth of knowledge beyond just sort of like more surface level description that you might see in quantitative research. And to focus on depth and this term thick description. That's the goal. And it's less so about causality. Causality is something that you're going to come across a lot in your quantitative research, which is to say, when you do this, this happens. Implement the program and you see a 20% increase or decrease in this outcome indicator, right? That's your quantitative goal, is to be able to do things like that. On the qualitative side, it is this focus on description that I think is where you want to be. Okay. So, given everything I've just described, I've got a fun kind of debate that we can have as a group here. And here's a scenario, and I would love for you all to think, to respond to this scenario. Using the polling tool, you can just hold up your phone to the QR code and read the question and respond with which of these three do you think you would choose given the scenario. So the scenario is your organization just launched a new substance use prevention program for middle and high school students across multiple school sites. The program includes classroom sessions, parent education nights, community awareness campaigns, and after the first year, your team wants to gather qualitative data to understand how the program is being experienced by youth, parents, and community partners that would then help shape the next phase of implementation. So do you have, so you have time to implement just one of the qualitative data collection methods in the cycle. Which would you choose? Once you've chosen, go ahead and select it on Slido, which of these three you'll choose. And then in the chat, answer why you chose the way that you did. And it should answer why you chose the way you did in the chat. Janie asked a great question here too about analysis, and we will get to that in the second part of our presentation. Different tools you can use, how you go about analysis and coding for sure. 37 responses. We're getting some debates here. This is good. 44 responses. Once it gets up to 50, we'll open it up and see what everybody's responding like. Here we go. How many do we got? All right. So we have 69% say focus groups, 21% say interviews, 9% say testimonials. I always get scared to open it up here because you see people changing their minds. They're like, oh, I didn't say testimonials, I said focus groups. We all sort of migrate to the one that everybody chose, right? All right, let's see what people are saying in the chat here. Okay, maybe focus groups because it involves a lot of people. That's true. You got multiple school sites, you got lots of parents and youth. Seems like a large-scale program. Maybe that would be helpful to have focus groups. So you have more data from a different cross-section of stakeholders, as Ina shares there. Excellent. Interview, because you'd like to gather information from each type of participant. Okay, very interesting. Good, good. Interviews, because focus groups can be difficult to get people to in rural communities. That's a good point too, right? So if it's difficult to get a lot of people together, I can't really necessarily get everybody together, but I know I can call somebody and I can at least have that one conversation. Sometimes you have logistics that can lead you in one direction or another. Lots of focus groups and the focus on emphasis on larger, yeah, this is good. Angel Aranjo says that I think that focus groups encourage them to be honest when they see they're not alone in what they're going through. That's really great. Sometimes that focus groups, we do it for the purposes of gathering information, but a lot of times the actual participation itself can have its own sort of like, revelatory or even emancipatory kind of pieces to it, right? Because it just helps people like have a chance to share their experience. And when they have that shared experience with somebody else, it can be so important and meaningful to them. So I'm glad you mentioned that. All right, Hannah says testimonials. Here we go. It feels like they give real feedback similar to user-generated content. If a group of teens says they had a fantastic time, the other youth interested in see that, they may also join. So there's an argument for testimonials. They only get 9%, but someone's sticking to it. I love that participation. That's a good point, right? This is the first year of the program, and you're thinking probably about recruiting for the next year. If you can get some solid testimonial data that are gathered from different youth who validate this program, or parents who validate this program, it might help you to grow and to spread this program and to really increase your enrollment, right? So all excellent points here. So I would say, let's do one more here. Kirsten says, I'd go with focus groups because they encourage open discussion among students, parents, and community partners. This helps us to gather detailed feedback on their experiences and gives insight that can guide to the next steps of the program. Yeah, excellent. And I'm glad that you mentioned the different stakeholders there too, because you might envision a different type of focus group with each of those groups. Maybe you have one focus group with youth, one with parents, and one with community partners. And then you kind of adjust the questions so that they are well suited to each of those different groups. Well, I will say that it's hard, but I tried to design this question in such a way that you could answer any three of these. Because really, there's not, I think, one of them that is the clear winner in each of these cases. It's going to take and depend a little bit on all of the factors that you mentioned. Capacity. Can you convene focus groups? Can you get people together if you're in a rural community? Do you have enough contacts and relationships to do that, to get focus groups to happen? Maybe, maybe not. Do you have the capacity to do 3 focus groups, but maybe you can't do 10 interviews? And so you're like leaning a little bit more on the focus group side. Maybe you really want that shared dynamic that comes up when youth are together, and focus groups are really important. Maybe you say, hey, we're pretty confident that this program went really well. We have a good sense of what's going on. We were talking to youth and parents while we were doing the program, so we got some good, formative feedback while we were doing it. Let's focus our emphasis on testimonials here, because what we really want to do next is try to grow this program and obtain the social validation needed to help that next youth and parent who's on the fence, who's thinking about it but isn't sure, say like, hey, yeah, okay, I see my friends have done this. Oh, here's a person in my community that I trust that say they did this program. Maybe I'll sign up too. Right? So you can see all of those different pieces. And I could see why you might choose any one of them. Jen raises a great point, but if you're only focusing on testimonials, you will not be seeing how you can improve your design. That is a risk, right? And testimonials, and here's the thing, it's interesting with testimonials because it kind of depends a little bit on the culture of your organization. We've all been the consumer of a product, and sometimes you go on Google and you see that this organization has 95-star reviews. It's like, are they just paying people, or are they just asking people who liked it to rate 5 stars and move on? You talk to the person on the other end of the line. They're like, oh yeah, if you could get us 5 stars, it'd really help me out at the end of the month here. You have these sometimes wonder if those ratings and things like that are biased. And so I think a little bit, Jen, to your point on testimonials is that they can, depending on how you structure them, be more focused on that social validation point and may then miss, opportunities to really talk about areas of improvement. Because again, you're in year 1 of this program. Maybe you found out that there's some major things that are not going well with the program that you miss with testimonials that you would have gotten had you done focus groups and interviews. So from a program, fidelity and implementation perspective, I think you raise a really good point. So those are just things to be thinking about. There's not one right or wrong answer necessarily to this, but there are well-informed answers that you can take based on a lot of the things that folks are sharing in the chat. So just use these to kind of generate your thinking and to push your thinking on how you might approach one of these. I did put a restriction on this that you can only choose one, but it may be that the best option is to choose more than one. All right, let's take a look at what data collection will look like. Let's see, how are we doing on time? 12:47. We're going to take a break this time. We got some feedback from the last time that for a 2-hour session, we'll do a little break. So we will have a 5-minute break coming up. I'm going to walk through the next section first before we do that. Okay, so with interviews, there's lots of things to consider with interviews. One subset of interviews that you've probably seen a lot in your practice in prevention is this concept of key informant interviews. And when I first saw that term, I was like, what does that mean? What are key informants? How do I define what a key informant is? I wanted to go find a list somewhere of what validated what a key informant is. And I realized that there is no such list. It's really kind of what you determine as is in your community. But typically what you're saying by key informant interviews is you want to interview people in the community who you believe have some type of unique vantage points or perspective on a topic of your interest. And so I've listed here school counselors, healthcare providers, law enforcement officers, youth workers, faith leaders, young people, etc. Right? All could be serving as key informants because they have a certain type of knowledge. What distinguishes key informant interviews from doing interviews broadly speaking is that if you're doing interviews as an evaluation approach, typically you'll just say, hey, we're recruiting people for interviews. Anyone can participate. Here's the information about it, and you send it out and you hope that people sign up, right? In key informant interviews, you're really doing a much more selective sample design, to use researchy terms. You're looking for specific people. You're sending a specific email to a specific person or a phone call or meeting up with them somehow to talk about it. And that's kind of what distinguishes key informant interviews from interviews broadly speaking. But they are so important and useful, particularly on the assessment side of things, because a lot of the challenges in the community are already known, at least by someone, just maybe not you. And by trying to identify who those people are, to identify some of those challenges, it can be really, really helpful. I think too, with key informant interviews is that you want to get a broad representation of lenses when you're doing key informant interviews, right? If you do 6 school counselors, but no faith leaders, no youth workers, no community nonprofits, things like that, You're going to get a very school-based perspective. And that is going to probably lead you in one particular direction as you're thinking about it. So, you want to be mindful that in your key informant interviews, are you getting a broad representation from your community? Does it include both professionals and non-professionals? Does it include people from different cultural groups and communities in your community? Does it include youth? Is there diversity in age represented in your key informant interviews? Does it include people who are in service delivery in some capacity, healthcare, behavioral health, mental health care, things like that? So those key informant interviews can be really, really helpful. Paul adds in here, in his opinion, that you should offer a generous incentive and an in-depth key informant interview. Maybe that's because you've been one before and you're like, come on, you're going to get an incentive for this. But Paul, I appreciate you raising that point because it can be really, taxing on someone's time to provide, an hour of their time or so to have a conversation with you about a challenge. So, offer an incentive structure, or if that would be weird in that context, maybe, take them out to lunch or something like that. It can be a nice way to be grateful to your key informant interviews. Now, interviews for program evaluation are typically conducted with program participants. So you envision somebody's done an evidence-based program, they were doing a life skills training program, a VOID program, something like that. And through that, you kind of typically will conduct those interviews after a program is completed. There are cases where you might do it in the middle to get some feedback midway, but sometimes that can be a little burdensome. So often it's done at the end. So that's kind of two approaches to interviews. I wanted to give an example of what an interview kind of flow might look like here. So if you're like, hey, I've never done an interview before, how would I write questions? What would that look like? Well, here's an example. And certainly you can use these questions or adapt them to future purposes here. At the beginning, it's always important to have some type of conversation, something at the beginning that just sort of sets the stage of what you're talking about. Thank the person for being there. Thank them for their time and their willingness to participate. Emphasizing to, when you're working with youth, sometimes they think they're actually being tested. Like they've gone and they're trying to answer a test like at the end of their school exams or something like that. And it helps them to kind of feel like, hey, I'm just interested in your perspective and your experience. That can be really important, particularly for youth. And then once you've done that, you'll see here as an opening question, I always recommend to give open-ended questions to let people to kind of get started by telling their own story from their own perspective. So an opening question, for example, tell me a little bit about yourself, how you got connected to this program or to this community. And you'll see in there that there's no questions that specifically say prevention or substance use in it. It's really just getting a sense of who that person is and how they got connected. Then you'll have 4 questions in there. And here I would say, depending on the length of your interview, I try to keep mine to be around 3 or 4. And then if you do that with the opening and closing questions, that's usually about a half an hour or so. It could be longer depending on how much that person wants to share. But your core questions are going to be where you start to really focus on the areas that you're most interested in. So for example, what have been some of the most helpful parts of participating? What challenges have you experienced? I like this one here. Can you share a story or a moment that stands out to you? And in those situations, you can get a lot of information about what those impactful moments were in the program. I think also too, when you ask people to share stories or moments that stand out, they tend to, but not always, they tend to focus on moments of change and transformation. I remember we had this conversation around alcohol in this program, and I felt like nobody had the same experience that I had. But then when all my friends started sharing these experiences, I didn't know any of this about them. That totally changed my perspective. Those are the kinds of responses you might get from allowing people to share a story or moment that stands out to them. A lot of times the stories or moment, sorry, my mouse always kind of moves ahead. A lot of times the story or moment that stands out to you as a facilitator is actually different than what stands out to the youth. And so in that case, it can be really helpful too to see what is it that is actually young people are saying are the most interesting parts of the program or activity that we're delivering. Then it's good to have some prompts. It says here prompts to encourage reflection. You can kind of think of these almost as follow-up questions. Sometimes you could say, like, you might ask a question, what was the best part of this? Oh, I like the part, when we talked about, after school activities. I'm just making that up. We might get, sometimes if you interviewed youth before, you'll get like a one line response. And you're like, all right, what do I do with that, right? How do I encourage more? In interviews, and from those of you who have kind of a clinical background or mental health background, you'll be familiar with this too, where you can use more follow-up questions and periods of silence to elicit more responses from others. So can you tell me more about that? Oh, that's interesting. What happened next? Or how did that make you feel? These are all questions designed to allow and prompt that person to provide more depth to their response. And so asking those types of questions can be really, really helpful. I find too that just offering moments of silence can be really helpful. If you share a moment or a story that stands out to you, and count to 8 or 10 in your head before following up and trying to add more detail or contextualize it, and just let the silence speak. That can be one of the hardest things to do as an interview facilitator, is to actually allow that silence to happen. That can be, I know that there have been moments in my time where I'm like, oh, I feel like I gotta fill the silence, fill the void. But I encourage you to remind yourself that as a good interviewer, give that space over to the participant. Let them fill it up with their thoughts, their ideas, their stories. And these prompts can be helpful in doing that. A lot of times at the end too, it can be helpful to ask questions about what you didn't talk about. You know, hey, I had all these ideas that I want to talk to you about. What did you want to share that we didn't talk about? And they might raise something that's really, really important that your program is missing. You know, hey, we're having this whole conversation about alcohol and vaping, but the biggest struggle that I see right now is marijuana and prescription drug use. You know, why weren't we talking about that? That could be something that comes up. Also, what advice would you give to other youth and parents who are in a similar situation to you? I think can be really interesting as well, because it gives you a sense of how individuals are making meaning of taking action or intervening on behalf of prevention initiatives. So anyways, those are some sample interview flow or ideas. Let's talk about focus groups. So when would you use them? Needs assessments we talked about. I also think focus groups can be really great for communications campaigns, testing out materials. Hey, we're about to launch this communication campaign. We have like 8 or 9 graphics. We're about to spend about 10 grand in ads to be able to put this out in the community. Before we spend that, we thought we would talk to youth a little bit to see, hey, what are these, what are your reactions to these? Do they change your perceptions on X, Y, or Z topic, right? I think communications campaign testing materials can be really great. And folks who come from the marketing sphere, who have a marketing background, will know that focus groups are used all the time in testing marketing communication materials. And then certainly in program evaluation. So focus groups after you've completed some type of program. Who you include, people with a shared experience. And we alluded to that a little bit earlier in the presentation. Parents, youth, people from a particular cultural affinity group, individuals with disabilities, for example. You might think of professionals versus community members. All those types of different groups are good to be thinking about who have some type of shared experience. You can bring people together who don't have a shared experience, and sometimes that can lead to a really interesting focus group because you might have more difference of opinion than consensus. But I think you can try both and see kind of what works in your community, in your setting. For length of focus groups, I recommend at least 60 and typically up to 90. Once you get up to 90 minutes, people are shuffling, they're ready to go, so you don't want to hold on to them too long. But I think that sometimes an hour isn't quite enough time to give everybody a chance to speak. So I would say budget 60 to 90 minutes you can. Try to keep your participants to at least 5 or 6, but no more than 10. Once you get over 10, it's really hard for everybody to participate, and it doesn't create that same kind of gel and dynamic. It's better to have more groups with fewer participants than to have one focus group of like 20 people, for example. I included in here a picture of Legos because, when we envision focus groups, we envision a traditional format of discussion questions, right? So I'll kick things off, we'll all sit in a circle, and we'll have some conversations around a structured set of topics that me as a facilitator offer. But I was actually a part of a really cool research project recently that was working with youth, and they approached the workshop in a way that was kind of blended a focus group with a structured learning opportunity. And one of those was to ask youth to design their desired futures using Legos. And so they got together as teams, they built these topics with Legos, and then they used the Legos as a tool to in turn then respond and share their ideas about what it is. So you can imagine saying a question, hey, what would a community that is drug-free look like? Design it with Legos. 10 minutes, go for it. And then have people talk about it. When that has a way of helping you to kind of brainstorm and share their ideas, and looking at those different responses can just be a unique and interesting way, I think, to have that conversation. So I shared that here so that you can think creatively, and I encourage you to think creatively with your focus groups. Arts-based approaches, giving people pens and paper to design or draw something and then share what that experience was like. Draft a timeline of your time in high school. What was that like? And how, and maybe it relates to substance use, or maybe it's just broadly. But, you can envision that those types of exercises give youth a chance to reflect, to think and deeply about a particular topic, and to design that response, but then also give you a real richness and depth in their responses and have kind of a structured way to respond. So with focus groups, think creatively would be my recommendation. Here's another example of what the focus group flow might look like. So you might say, hey, introduce yourself and share a little bit about why the group is being held, explain how the information will be used. A difference that you'll have in focus groups that you won't necessarily see as necessary in interviews is to establish ground rules. And most of the time, people are like, yep, I get that. We've done this before and you can move on quickly. But I still think it's worthwhile to at least discuss them up front to kind of set some expectations among the group. Not because people aren't going to necessarily respect ground rules, but more so you're talking about sensitive topics. Right? And you're going to talk about people who a lot of times maybe have experienced difficulty, challenge, trauma. And so by establishing these ground rules, you're kind of creating a space that is going to be safer for those participants, but also sets a baseline that you can call people to if something happens during your focus group. So I think that those ground rules, that's a key distinction between the interviews that you want to include when you're thinking about focus groups. As an opening question, I also love trying to be creative too and open about how you might approach a focus group. So here it says, let's go around and everybody share their first name and one word to describe community. And that, I think, is to give people a chance to focus in on that one answer. Maybe they then reflect and respond on why they chose that particular word. But it's a great way for everybody at the very beginning to participate. When you have an opening question that just says, tell us about your community, but it's open to everyone, quickly you're going to find that 2 or 3 people are going to dominate the conversation. So when your opening question, if you can ask it in such a way that everybody introduces themselves and then shares something, it sets an expectation that everybody participates and that not one person is going to dominate that conversation. You'll note here that I say, and share your first name. In many cases, you'll be recording your focus groups, and I don't recommend that you include their full names, just for an additional protection of the data. You can even not include first names, depending on your kind of the context of your situation and your own protocols. You may even want to remove first names. But I would say that if you're going to have names, use just first names in the conversation. And you may even include it in your welcome and purpose. Say, for today, let's either not use names or use a nickname or just use your first name. So that way, the data have just an additional level of protection if you're recording in particular. All right, some core discussion questions. So just like in the interviews, after you have that opening question, then you start going in depth and you start asking your questions. And again, for focus groups, I really think most of the time 4 or 5 of your core questions is really all the time you have. And if everybody is sharing their ideas and you're following up and allowing that conversation to happen, you're going to easily fill 90 minutes. Some core discussion questions you might think of are, what are some strengths you see in the community around supporting healthy choices for youth? I included a strength-based question here because a lot of times we can focus on pathologizing things. It's always the challenges, the problems in the community. What's wrong? What's wrong? What's wrong? What's negative? What's bad? But a lot of times the very solutions to the problems in our communities come from those areas of strength. So having some strength-based questions in there can be really important. What concerns do you have? What resources or supports would help address? Can you share a story or example that illustrates a challenge or success? And these are general questions. You certainly would get them more specific as you're focusing on your own particular area. You'll drill down probably more specifically than what I have here. And then at the end, maybe a question, can you share a piece of advice as a way to close it out? So those are kind of what a focus group flow would look like. Again, very similar to the interviews. The key differences is having those ground rules and setting that expectation in the beginning that everybody has an opportunity to participate. Okay, let's talk a little bit about testimonials, and then after this, we'll head to our break. So testimonials are short personal stories that bring impact to life. That's kind of their goal, in creating social validation for your particular program or sets of activities. The idea is, hey, look, I have accomplished this thing. You can accomplish it too. Now, the formats for testimonials are also very numerous and can be very creative as well, kind of like in the Legos example for focus groups. You can have testimonials just added as an end of survey open-ended question. Any survey you ask, just say, tell us about the impact of our organization on your life, and just add that in there. And you'll be, I think, very surprised to see the depth that people will give on some of those survey responses and how helpful that can be for you in telling the story of your organization. You might think of exit interviews with staff members who have participated, with volunteers who have participated, exit interviews conducted by staff of participants. So anytime somebody finishes a program that they have an opportunity to do an interview could be great. You might think of structured interviews with like a professional videographer. That's when you want to do the sort of video testimonials, which can be really powerful, especially in the development space. You see that a lot of times for fundraising purposes and things like that for your organization, to be able to have opportunities for videos of people telling their stories. You can envision using them, doing it as a part of a social media campaign. So if you have a strong social media following on a particular channel, you might go out to that community and ask, hey, we're coming up on a day of importance. It's Mental Health Awareness Month. It's Giving Tuesday. Any of those types of months that might be really important to your organization. And we'd say, hey, for this, we're going to do this big social media campaign. We want to have a big presence across all of our channels here. And we're asking you to spend 2 minutes to just share a story, either in written format or a selfie of you as you're walking into work, about why you think this organization is great, and then link to us. Something like that can be really powerful too. Then you're not doing any of the videography. You're not doing any of the sort of production work that is often associated with gathering testimonial information. It's just allowing people to respond and share on social media, which then in turn increases the awareness of your organization. There's always that 5-star Google rating, and sometimes it'll be interesting when you talk to prevention organizations. Look yourself up on Google. Do you have that presence online? Maybe people have rated you and you don't realize it. So being aware of what that looks like can be helpful. I mean, I don't think that most people use Google ratings for the type of work that we do, but I just think it's something to be aware of as an organization. Your online presence, is always going to be a means of providing social validation or discouraging folks maybe from participating or engaging with your organization. So you want to be mindful of all the different ways people might try to seek out that social validation and understanding of who you are and to see how you're represented. Certainly there's case studies you can do too, where you have an opportunity for maybe like a structured interview where you ask people to talk about maybe transformation of some sort, some transformation they've experienced, and you can share that case study. Or a case study maybe not just at the individual level, but at the family or the community level as well. Here's a case study of this new program that we've been doing in partnership with our faith-based community. We have been launching this family program that has communication with adults and with children in churches across the community. And this is what it looks like. And here are some photos, and these are some testimonials as part of that. Those case studies can kind of share a little bit about, what it is you do and how you accomplish it. And there's always the good old-fashioned comment box, which we're seeing less and less of now. I feel like as things are getting increasingly digital. But if you have a place that gets a lot of traffic, a lot of in and out, I think a lot of folks, and maybe in the harm reduction space, might experience this too, because they have a lot of on-site kind of interaction with clients and participants. Just having a paper and pencil comment box could be a really great way to gather some of that feedback. So what would you use those testimonials for? Reports, grant applications, presentations to board members and funders, websites, social media, outreach, storytelling, all of those things that you can use them for. So the key for testimonials is a lot of times we kind of think in the opposite direction. Oh, I'm doing a grant application, I need a testimonial. Oh, I'm doing a presentation to a board, can we get something on this topic? And then you're thinking, oh, now I have to develop this process for testimonials. What I recommend is that you pick any of these formats here, ones that make the most sense for you and your community, and you pick one or two of them and you just make them a regular practice. And then anytime you have to fill out a grant, do a presentation to a board, you can go to that well of testimonials and pull out those that are most important or that most resonate with your audience to prepare yourself for that. So speaking of, since it's sometimes kind of fun to see what people would be interested in, what would resonate, let's talk about from your perspective. If you could select any format to collect testimonials at your organization, which would you select? Select 3 and then rank them in order of importance to you. So if you grab your phones and just QR code up in the top left of the presentation here, or you can go to slido.com and enter in the number and passcode, you can respond to this question as well. Given all of those rank or different options that we have for testimonials, which would you choose? And then once you've chosen the 3 that you think would be most relevant for your organization, go ahead and rank them from 1, 2, and 3. And I'm actually fascinated. I have not done a ranking question with this particular tool before, so I'm very curious to see how it's going to tabulate the results of both people's responses, but also how they are ranked. I'm seeing here in the comments too that Connie had mentioned doing a safety training course that also incorporated Lego builds as a team building activity. Awesome, I love it. You know, we've all had those experiences at like a a workshop or a retreat of some sort where you've done team building. And I think sometimes in the research world, we've kind of like closed those things off and said, oh, that's not research. Structured research has to be structured questions. And it has to follow this very researchy and formal process to be a rigorous evaluation. And yes, there's some truth to that. But I have, the more and more I do focus groups and interviews, I think the ones that bring a creative element to them are some of the most fun. And I think also bring out some details and information that you never would have gotten in a structured interview. So I'm starting to become more and more of a fan of the creative ones as we do these focus groups. So Connie, thank you for sharing that example. All right, let's see what we got. Okay, here's our numbers, right? I wonder how it doesn't give a number here, but it just sort of ranks them. Interesting here. Okay, so the ones that people seemed to resonate the most were the end of survey open-ended questions, social media campaigns, and exit interviews with staff members. All right, very cool. And what's great about these two, especially the top 2, is how it doesn't put a whole lot of burden on you and your staff to accomplish them. If you're thinking of whatever surveys you're already doing, you can just add that open-ended question at the end. Tell us a little bit about the impact of this program or this activity on your life. And then gathering that information and those stories from folks who are then happy, many times very happy to share and excited to share how your program has impacted their life in a positive way. So that's a very simple, easy one to do that you can walk away with right after this. Add just one survey question at the end of whatever surveys you're already doing, enrollment forms or whatever, and you can use that. Exit interviews and working with staff can be great. Or just whenever somebody completes a program, just have a process for doing an interview. Hey, would you be willing to be interviewed for this company? We'd love to get your feedback. Fantastic. And then the social media one, which I think it depends. If your organization doesn't have a strong social media presence already, it's not going to be it probably will be limited in its success as an effort. But if you already have a really broad social media campaign like presence, and that if you put material out there that folks are going to engage with it, man, what a great way to build that social validation and to extend your reach. Because when people start sharing on their own personal timelines, timelines, look at me, I'm so old. When people start sharing on their own social media channels about your organization, you can really extend the reach of your work and have more people get to know who you are and what you do. So there's a few more things I wanted to talk about with testimonials before we get on to our next section. But first with testimonials, I think the key things you want to be thinking about is how do you structure your testimonials in such a way that they aim for real authentic responses from the person. What's great about reading testimonials and reading people's feedback, perspectives, comments, whatever it may be, is that the ones that resonate the most are the ones that are clearly someone that wrote it from an authentic space, that they were writing in their own words. They weren't just regurgitating what you wanted them to say back into that. Everybody sees that as kind of fake, right? So a way to do that is to avoid seeking praise. And you can sometimes find different ways to encourage people depending on how you ask the question. to get at this, and instead focus on their process of change. So instead of people saying XXX organization is so great, 5 stars, awesome, yay, which I mean, it's helpful and good. But what's really great, and those powerful testimonials are the ones that say, hey, talk about your story. Talk about what changed. Talk about the transformation that may have occurred with this process, right? And that's really what you want to be focusing on with testimonials. A couple things to keep in mind too around ethical use of testimonials is making sure that we're asking permission and asking to share how, and discussing with the person how it will be used. And if it's possible, I mean, depending on how you structure it, like if you're doing a bunch of surveys, it may not be possible to always reach out to folks every time before publishing. But to be clear about how it will be used, I think up front is going to be important. And if you say you're going to use it in general marketing purposes or something like that, or for general grant reporting purposes, that can be helpful, just so that people know how it's going to be used. With testimonials too, around ethics, you can run into issues where sometimes you feel as though you're taking advantage. There's a power dynamic where sometimes the person who is seeking the testimonial and the person responding are in such a power imbalance that the person responding, sometimes their voice is not fully captured or shared appropriately, or sometimes almost manipulated to the point of being used for specific organizational purposes that are beyond what the individual really desired. And I think that it's always important to be reflecting on that, right? If you're going to be sharing someone's story, particularly if you're doing fundraising work with it, it gets really sensitive around how that is being used in a way that is ethical and responsible. The best way to address that, again, is to focus on building that trusting relationship with the person who provided the testimonial in the first place, asking for their permission and sharing exactly how you intend to use it, and ensuring that you have that consent prior to sharing and distributing it. Here are some examples, some prompts that you could use at the end of a survey or in any other type of place that you might try to gather that. What would you want others to know about your experience? How has this program or service impacted you or your family? What have you learned or gained? What advice would you give to someone else? Or all kind of different ways that you can ask that that testimonial type question. All right. Now I want to get into some technical considerations to come up when you're doing your data collection for interviews, focus groups, and testimonials. And for recruitment, where you really want to start is to recruit from your own community with people that you already have a relationship with. Always start there. It can be a little bit tricky when you're doing that for needs assessments because sometimes you're trying to gather information from people you don't know. But in most cases, you want to be able to recruit from your own community and partnering with schools, faith organizations, local coalitions, but especially those that have trust in a long-term relationship. One time I was actually, at my church on a Sunday, and a group of researchers came in and they wanted to ask questions about people there. They had not talked to our pastor or anybody at the community. They just sort of walked in after Sunday and just started asking questions of people to gather information for some purpose that they may have had. They had no relationship with the church. And people felt really like, why are you doing this? You're coming in our space and just trying to extract this information to take off for some research project that you may have. And it left a real bad taste in everyone's mouth, right? So you don't want to do that. What you want to do is go and work with places where you already have an existing relationship. And if you don't have one, that you see whatever data collection you're doing is only one piece of a broad set of things that you intend to do with that community partner. And emphasizing that trust and long-term relationship. That's really the best thing you can do for recruitment. As someone had shared earlier in the chat, incentives maybe aren't that effective or can only go so far. And I think that that's so true when it comes to recruitment. We think that, hey, if you just have an incentive in there, you're going to be able to buy these responses from people. And that's just not true. Now, it's not to say that you shouldn't do incentives, and we'll talk about incentives in a minute, but incentives should really be seen as a part of a whole broad array of things you do for recruitment. Recruitment means reaching out to people and organizations that you trust, setting it up in a comfortable and approachable environment. It means having flyers and communications and well-written emails and social media posts. And then it can also mean including incentives. Any one of those pieces on their own is typically not enough to recruit people for your qualitative evaluation purposes. What we need is to engage in all of them together as a comprehensive package to increase the recruitment for participation. I also think that you can invite your community to help. I was involved with one local coalition, and we wanted to do a very big needs assessment, but we were trying to figure out the best way to reach parents and youth. And we could do something, with the folks that we knew or that always came to our programs, but we knew it would be small, and we knew we would hear a lot of what we had already heard from our own community. And we wanted to extend beyond that. So what we did instead was we reached out to 15 parents and adults that were well connected to our organization. And we said, can you help us do interviews in the community? And we gave them an incentive of, $10 or $20 per interview to go out and conduct up to 10 interviews on their own, reaching out to other adults. Everybody had to be over 18, but other adults, to have conversations about substance use and behavioral health challenges in the community. And we got over 170 interviews and data back in a structured interview, or in a structured form, that all those folks went out and did in the community and then brought back to us. We approached it, we trained them, we had incentives, we had a whole process and protocol in place to ensure that it was done well. But then we were able to gather a lot of information from a whole bunch of people, many of whom we did not know. And the information we gathered from that has informed the direction of the coalition since. It was so incredibly helpful. And so sometimes you can invite others to help you in the process of recruitment and to find different ideas and strategies to help them, go out and do some of that data collection with you. And I think that's going to be a really, really powerful approach as well. And then certainly you've got your flyers and social media and outreach. But as you guys have all probably know, those things on their own are never enough. They all have to be done in collaboration with these other strategies. Now, incentives. So it certainly can be a good idea to compensate people for their time. It can increase your number of participants if it's done in conjunction with other things. Certainly when you're working with youth, bringing food to a focus group can be helpful. Gift cards are great. Transportation support, people say, hey, I'll be there, I just need help getting there. Entry for a prize drawing, things like that can all be great strategies. I find that if you're going to do some type of monetary compensation, somewhere between $20 and $30 is typically good. It can go as high as $50 depending on how well funded you are and how long the focus group is. You may want to go that high. So these are all different kind of options that you can include. I also included here tremendous.com. I'm not endorsing that necessarily. It's just one tool that I've used that has been helpful. Is a way to distribute those cards online. It requires an email address, so it doesn't work in every situation, but it can be useful, and it gives you a whole different array of gift cards that you can choose from, and it makes it sometimes a bit more efficient to be able to get those gift cards to people, because sometimes it can be kind of tricky. The gift cards, there's a lot of challenges when you go and buy a bunch of them, and keeping track of them and an inventory of them can be tricky too. So sometimes doing it electronically can make that process a little more simple. So those are some things to think about with incentives. Always be mindful to keep in mind informed consent as well. So being clear with people what the purpose is, how it will be used, what are risks and benefits, will it be anonymous, confidentiality, privacy issues, all those things you want to be thinking about with your informed consent process. And remember that, sorry, it says you, but it should say youth there, my apologies. Youth cannot provide consent. They will need parents or guardians to do so. And if you're not sure about how to write a consent form, consider speaking with an expert, an evaluator. Your PTTC, for example, could be a good one. Sometimes in some cases, you may wish to speak with an attorney as well. So those are all good examples for getting those informed consent forms in place. Recording equipment. So I actually took a picture of the microphone that I like to use for focus groups that I do. I have two of these that I use and try to place both of them in the room so that way if one doesn't work well, the other one will be hopefully capture the whole recording. But you don't have to use recording equipment. I just like these because with focus groups, sometimes it's hard if people are sitting far from each other. Sometimes doing something on your phone or a laptop might not be as effective in getting all that audio in a quality that you can then turn into transcriptions. But I do like the Zoom H2N recorders. There's a ton of them out there that you can use, but this one was really, I found recently used and come to really like. So if you're looking for one, I recommend it. You could also do things like have a professional videographer, especially for testimonials. It's probably less appropriate to do video for interviews and focus groups, and a lot of times because you're trying to do something that's confidential. So I don't know if I'd recommend a videographer in those situations, but for testimonials, absolutely, because the expectation, from both you and typically the person who's giving the testimonial is the understanding that it's going to be used for communications and marketing purposes. Another thing to keep in mind too is that it's helpful to have interpretation services, cultural ambassadors, other people if you're working with different groups. If you need someone who speaks Spanish, French, Mandarin, etc., it'd be helpful to have one of those people in the room when you're working to conduct those interviews or focus groups. And as was shared on the chat earlier, it's helpful to have more than one person always, because with one person, sometimes you forget something, sometimes you forget to hit record. Some situation is happening with one person that needs individual attention, but you still have to continue the focus group with everybody else. And so I recommend always having at least more than one. And sometimes, depending on the circumstances, two can be very helpful as well. All right, actually, I'm going to pause real quick on some of these technical details and ask if anybody's got any questions, things on incentives, on recording equipments, on consent procedures, recruitment, any of that kind of stuff. Let's see what we've got in the chat. I lost my chat. Okay, here's some other examples. So Yanis shares that they were required to pay minimum wage for each hour of the focus group. That's interesting, right? So if you see it kind of as labor, paying minimum wage for it, for compensating for people's time, that's great. Using gift cards to Starbucks, Dunkin's, Subway, Stewart's, that's excellent, great. In college, Jen shares that they worked on a research team and typed out or transcribed the notes from a focus groups that they were doing. Is this an option or outdated now? Ooh, let's talk about transcription. That's actually a great segue into the next topic. So the review and transcription process. Typically when you do focus groups or interviews, it's a good idea to take notes if you can. But now with recording, actually, I find that people are increasingly not taking notes because they want to devote their full attention to facilitation, which can be, I think, really wise, just to be giving your full attention to the people in front of you. But if you do record notes, whatever, or if you want to just write down things that happened during the focus group, it's best to do it right after the focus group happens, because then the memory escapes you, right? But then you can transcribe the audio conversation. So it's taking an audio file, an MP3 or a WAV file that you have on a recorder, on your phone, or something like that, and then transcribing it using some digital tools. Now, there are some great audio transcription tools out there, and with AI, it is getting so good at doing audio transcription, and it is saving so much time. When I was in grad school learning how to do evaluation work, as Jen shared there, we had to type out and transcribe the notes, and it was a lot of play reverse into your headset and trying to type all that information out, and it took hours. And the audio transcription tools that we have now can really save a lot of time. You still have to kind of go through it most times and review it for make sure that's correct and all that, but it can save you quite a lot of time. Some AI tools also can run locally on your device. I think one of them, I use a tool called Mac Whisper for some transcription purposes. And that can be really helpful because it does it locally and it's not in a cloud, it's somewhere else where the privacy or confidentiality could in theory be compromised if that company experiences a breach of some sort. So sometimes it can be helpful to focus on some of those tools that run locally, but again, you'd have to speak with or get a sense of what your security protocols are at your organization to be able to accomplish that. But I do recommend trying to look into transcription services to save you time so that you can get that written out as much as you can. Then we get to the analysis section here, right? And so you can imagine once you have the transcript of the focus group, say you did 3 focus groups and you've got 3 transcripts, the next step is to go and read back through them and to do a process in qualitative research called coding. And the best way to kind of explain coding is that you're going to go and identify themes in the data, themes and patterns in the data. So for example, you might say a youth is describing their experience in their program and they talked about beforehand how they had all this stress. So you might have stress experienced by youth as one of your codes. What you do is then kind of in the margins, if you're doing it by hand and you've typed it all out and you're coding it by hand, you might note a code for experiences of stress. And you say that's a code, and then you use that code and you write it down in the margins. Every time you see that theme come up, across all of the different focus group transcripts that you have. And this picture example here is using Post-it notes. You could do it that way too. But that's kind of how you might go through and actually code the data. And again, as I shared before, when I was in school, we were just sort of on the cutting edge of developing more digital and qualitative tools. So you could do coding using tools like NVivo or Deduce. There's a number of great qualitative ones out there. They typically cost a little bit, and for some organizations are maybe cost prohibitive. So I haven't talked about those in depth here, because I don't think in most cases you'll necessarily use them. But if you're just doing a few focus groups or a few interviews, you can really do the old-fashioned method of just printing off the transcripts, laying it out on your dining room table someday, or maybe you got an office, a conference table at your office, and then just going interview by interview and identifying those themes, writing them down in the margins, and then going back and then looking, say, hey, all right, we're going to write and do an analysis on the stress, and we're going to do one on program participation, and we're going to have another theme on parent support, and we have another one on peer influence. And going across your different transcripts and identifying what were people saying about those themes, and then finding ways to sort of analyze and bring those together in your analysis to then share how the group was responding on that particular theme or topic. I think it's also wise when you're doing qualitative research to include quotes from participants directly, especially if they kind of get at a particular core of a theme or an issue or a point that you're trying to communicate. So that's kind of the process for qualitative analysis. There are entire degrees that you can get in how to do this extremely well. But for your purposes, I have not gone into too much depth on the analysis section. But I think there's also a reticence by professionals who maybe don't consider themselves full-time researchers or evaluators from doing qualitative analysis. And I hope that you come away from this recognizing that it's not something that is so complicated that you can't do it. All you have to do is get those transcripts in place and go through some type of process of coding. And if you want to refer to an article or a book on qualitative work to see how you might do coding in a more detailed or structured way, you can do that to kind of beef up your skills. But at the end of the day, if you're just going through that process of identifying themes across your work, you're already doing the bulk of what you need for qualitative research work. Okay. Reporting. Once you've done your analysis of your interviews and focus groups, maybe you're looking at your testimonials as well, you then have an opportunity to share that information. And I have all these different ways that you can do reports. Evaluation or annual impact reports. I recommend that every organization do at least an annual report of their programs and services and have some impact data that is both qualitative and quantitative included in that. So that's a key one I think that every organization should be doing to some degree. You might think of including presentations to staff, boards, funders, stakeholders, etc. You might have story highlights on your website or social media. Here's a picture and a testimonial in particular can be really helpful on websites and social media. You might have presentations that you give in the community, visual tools like infographics that combine stories with data. You can even include qualitative data as a part of some of your quantitative dashboarding that you may be doing in your organization. I think that's a really cool way to kind of integrate those two. And on the next slide, we'll talk a little bit about that. And then video presentations. I have come to realize that there are so many reports that are done. You spend all this time and it's these like 10, 20, 30-page reports of all the great work that you've done with all these charts and graphs and numbers. And then it's, you submit it to your funder and then it's done and it never gets shared or brought out or communicated to anybody. It just sits as a PDF on your desk and you're like, well, I just put all this work into this. Like it was so important, or I thought it was, but I feel like only 3 people have seen it. You want to avoid that. And what I've found is that after you do some type of annual report, slice it up into different types of communication formats. Put it on an Instagram reel. Put it in a 1-minute video that you design in Canva. That's just a video, or it's just like a presentation, like a PowerPoint with just music over the top of it that highlights the 3 things that someone needs to know in 60 seconds or less about your program or your impact. Having some type of way to communicate all of this great work that you're doing in something other than a very long and lengthy report that only a handful of people will read is so critical. Otherwise, you've done all this work, but the real benefit isn't shown, right? You got to get it out in front of people. Olivia has shared in the chat too that our third webinar on April 22nd, you can sign up for there, is going to be dedicated entirely to this topic, which is just how do we get information in people's hands that we're collecting, quantitative and qualitative alike, so that you can demonstrate that impact, communicate the importance of your work in effective and meaningful ways. Now, I do want to share a little bit too about how you might pair quantitative and qualitative findings together. And this is where I think it can be really, really powerful in helping to tell that story of the work that you do. So in the first example, in a vaping prevention program, for example, you might say, hey, survey data show that 72% of students reported increased knowledge about the risks of vaping after participating in a prevention program. But then in an interview, one student shared, before the program, I thought that vaping was basically harmless, but now I understand that it can affect my lungs and my future. I talked to my friends about it too. They probably wouldn't say it exactly like that, but you get the idea, right? So you have a way of, my mouse sometimes is ahead of me, of taking some type of quantitative finding or statistic and then sharing it and pairing that with a meaningful story or experience that someone had as a part of your program. Same thing on the parent engagement side. You have an example there. Parents attended workshops, 85% feeling more confident about talking about their kids. And one parent said, I used to avoid the conversation, but now I feel like I have the real tools that worked for me. So try to think about ways you can pair those things, especially when you're doing your annual reports or when you're doing a quick short on Instagram. How can you compare or bring together and weave the qualitative and quantitative aspects of your evaluation work together so that you have hard data, but also the story that it can be so helpful for people as they make sense of who you are and the impact that you have. Speaking of stories, what makes a good story? What I would love is to get some little bit of participation. This is our last section here. Complete this sentence in the chat. A story that stays with me, or one that I remember, is one that does what? Go ahead and drop your response in the chat. What makes a really good story? How do we know that it's going to be something that's meaningful and that you will remember? Or that someone that you communicate it to will also remember? Blake shares is one that challenges my worldview. Interesting. There you go. So a challenging story, like kind of like is edgy or brings something new or controversial maybe. Tears and heartstrings, Trish shares. Sometimes we do have that has strong sense emotional. Abigail says emotional response. Connecting with others, one that's memorable. Someone who connects data with their stories. Ooh, we have so many ideas dropping in here. This is great. Something you feel related and a connection to. Awesome. Something that's purposeful or personal that makes a connection. Ooh, has a call to action. Thank you, Rose. I think that's a good one too. Always having that call to action is important. Building a sense of empathy. Trasha says, excellent. A teaching moment. Excellent. Feels, quote, real from Emily. Authenticity is so important in storytelling. Absolutely. Adding personal context as Melanie. Vivid imagery, a call to action. Excellent. Something you can relate to, a story that questions your values or goals. Inspiring and tear-jerking. Excellent. All right, great. These are all great responses here. So I'm going to share 5 that I would add to this list as well, that of things that make a good story that maybe you can think about. And whenever you think, I've had the pleasure of some people in my friend group, in my world group, their professional group, who are good storytellers. And whenever they tell stories, I just love to just listen to them do it and then try to reflect on it afterwards, like what made that story so memorable or so funny? Why was I laughing so hard when they told that story? And these are some kind of standard, I think, things that come across a lot in storytelling. One is a clear hook. So is there something that, that you can use to start off a good story? In some of the workshops that I've given, I tell a story about how I used to have a CDL and drive a bus. And when people look at me the first time, especially if I'm dressed up in my consultant garb, they're like, oh, you were a bus driver? Really? And so that's like my hook, and it starts into a broader story. A person at the center, right? The key for a good story is that it's got to have some type of individual or person that's driving, a hero sometimes in the story can be excellent. The third one thing I think is actually one of the most important is that there's some type of journey or change. Especially when it comes to sharing impact of the work that you're doing, having that transformation process is so critical. What was it like before? What did it change to afterwards? And then we mentioned a lot in the chat here on authentic voice, authenticity, trying to find ways to ensure that it's real and not something that was generated by AI or something, right? And then having some type of purpose or takeaway. We had the term call to action show up a couple times in the chat, which I think is another great way of thinking about it. Like, what does that take you then to? So excellent. Tarsha says a story that takes me back to my childhood. I think that's a good example too, right? You want to have like drawing from a shared connection or a sense of empathy can be super important there as well. So these are some good things to think about. Good leaders certainly find and communicate the meaning in their story, and this is a skill that I think we all as prevention professionals, isn't going to show up necessarily a lot in the training that we do for our work, but I think is so critically important. It's helping to tell these stories. And your role is both facilitating that conversation and allowing participants and volunteers and stakeholders of your organization to tell their story. But also, as you're writing an annual report, as you're crafting together something to share on Instagram, if you're putting together a 2-minute video that you're going to share at a gala, you're becoming a storyteller. You're choosing what goes in and what doesn't go in. You're going to identify how you want that story to be framed. And so thinking about some of these 5 points here and trying to find ways to include each of them and all the storytelling that you can do can help you to take the next step of communicating all this information that you're gathering in the context of evaluation, in the context of testimonials, and then get that information again out into the community. And again, we'll have another tongue twisters at this point in the afternoon. We'll have another workshop next week that talks about each of these 5 points. Okay, well, I'm going to pause it there. We are done with a little bit of time left, 1:47. So we have about 10 minutes here. I'm happy to hang out here. You can come off mute if you have any questions that you would like to ask me about qualitative approaches to evaluation work. You can drop them in the chat as well, and happy to continue the conversation. And for those of you who were joining all the time, thank you so much for coming. So let's open up for questions. There's actually one question in here that someone brought up earlier about forms. So I do not have copies. I don't have any kind of copies that I can share at the moment for consent forms or things like that. But you can oftentimes kind of Google around and see what you find that's already out there. That can give you some good examples of what language you might want to include. And I do recommend looking at institutional review board websites. So institutional review boards are these institutions at universities that try to ensure ethical use of, ethical practices in evaluation and research. They're telling their researchers at the university how to do their work ethically. And a lot of times they'll have whole websites and kind of guidelines on what to include in informed consent forms that can be super, super helpful. All right, let's see here.
Hey, Drew, I see somebody has their hand raised. Elizabeth Morris, if you'd like to come off mute, you're welcome to do so. Or you can, go ahead. Or you can also drop your question in the chat.
Jen has a question in the chat here that we can try to answer. Can it be valuable to do a focus group when you have a small team and a small program and just read the focus group highlights to inform programming directions and developments rather than an extensive analysis? And I would say to that point, I think it's always, like sometimes we might look at something like doing a whole set of interviews with focus groups and say, I just got too much going on. I don't know if I'll do it well. And all the reasons not to do them kind of start to flood our minds. And to your point, Jen, like a lot of you are hardworking people who have a lot going on in your lives, and you can't necessarily do, a PhD research journal version of qualitative research for what you're trying to accomplish. And I would say you don't have to do that version to accomplish what your goals are. I think the key is what are you trying to accomplish with your focus groups? And if you can accomplish that in a more light touch kind of way, in a way that involves a more, maybe a smaller number of, just one focus group instead of dozens of focus groups, right? And maybe doing just your own analysis, I think can be a really informative and good approach, rather than doing this deep, extensive analysis. So I would encourage you to do it. What I would be mindful of, however, is that we shouldn't do interviews and focus groups just to do them. If we're going to collect that information and ask a lot of people's time, then we should feel ethically responsible to share the findings. Like, do the analysis, share the findings, get it back to the people who participated so they can see how it was done and how their time was spent and used to create something, some knowledge, some information, or something useful. If we do focus groups and interviews and then we don't actually spend the time analyzing it, well, that's a waste of people's time and your own as well. So that's just one thing I would be mindful of. Other questions?
Drew, when people are thinking of their questions, I'm going to go ahead and take an opportunity to put the QR link for the evaluation. If they're okay with that?
Yeah, go for it.
Okay, awesome. So let me go ahead and share my screen. Oh, sorry. Here is the QR link. If you please take the opportunity to fill out the evaluation. After all, this is an evaluation workshop. So I hope that you came here because you value evaluation. And we also use your feedback to inform future offerings and then make things better on our end. So please take that time to fill that out. After you fill out the evaluation, you'll have the opportunity to download your certificate. I will also be sending this out post-webinar along with the link for the recording, all the materials for today's webinar, and a thank you for attending. Drew, as always, I love spending my afternoons with you. Olivia and Chisholm are also putting in the link to register if you haven't already for next week's workshop. It's the final one in our series. So we'd love to see you then. Again, here's the QR link. I'm going to take it off the screen and then we'll allow for extra questions and we'll wrap up today. Thank you so much for being here. I see someone has raised their hand. So Rose, if you'd like to come off mute and ask your question, you're welcome to do so.
More of a comment. I work for a university, and so when I did community-based work, sometimes we would find academic classes to partner with that are assessment-based or social change-based, and they took us on as a client for the semester or for the year, and we're able to do some of that focus group or those interviews as an extension of our work. So I think there are opportunities to try to partner, right, with other groups that can maybe help you get the data that you're looking for without having to do all the lift. Obviously, there are huge pros and cons to that. It's a great learning experience for the students, but we found some really good success, again, being a case example for an academic class.
Great example. Yeah, I've taught program evaluations at the courses at the graduate level that have had that as a requirement, where they go out into the community, build a relationship with a partner, and then do some type of evaluation work with them. As you're doing it on the practitioner side, always be mindful that when you're engaging in those research partnerships, and I think, Rose, you alluded to this a bit, is just to make sure that you have strong alignment in your goals, making sure that whatever the student's project is, that it aligns with what you want to accomplish, but also that what you want to accomplish is going to help the students accomplish what they need at this, as their complete requirements for their course. If you don't have strong alignment, it's usually, I think, best to actually walk away from those, because then you're not going to have the hardship that could come out from if it doesn't work out. But when you have that great alignment, you have this awesome experience. Students learn a ton. You're able to gather some information and evaluation about what you're looking for, and it's fantastic. So just make sure that you have those conversations up front to make sure that you have that alignment that you're looking for. Cheryl, go ahead. I see your hand raised.
I just need the QR code again. My phone was slow. So I could do the evaluation.
All right, Amber's going to bring that back up. I see a question from Zach. For research purposes, do you have general advice for going about selecting a conceptual model for structuring your focus groups and interview guides, which will also guide the analysis? How do you select one? How do you avoid being overly constrained in analysis? That's a good question. And I think for most purposes, when you're doing practitioner evaluation work, I actually have found it to be sometimes too constraining to try to look at specific models and try to like follow them all the way through. And so in some cases, I think that, as I actually walked through this presentation as thinking about like, hey, should we talk about like, grounded theory as an approach to qualitative, research? And we could do that. It's a bit researching and jargony. And that's not to say that's not important. It'd be really helpful. It is. That's what we as a researchers, we have foundational models and protocols that we use, to guide our approach in research. So I think that if you have the time and expertise and interest to take those on, I think that can add an element of rigor to your evaluation work. But I also want to be mindful that going down such a route doesn't put up the type of barriers that might keep you from doing the work. So even if, a focus group is something that is as simple as a conversation with a group of people. And sometimes I think we overcomplicate the simplicity of that by trying to apply the rigor. It's always a balancing act. So I don't want to dismiss the research models and the rigor that comes with that. But I also want to make sure that people feel free to do the work at the ability level that they have. I hope that answers your question. I'm not sure. Jen asks, do the methods to analyze focus groups apply to analyzing interviews? How would you organize findings in exit interviews, for examples? Yeah, I mean, the process of coding is ultimately the same as you would apply it to interviews and focus groups. Certainly there are some differences there because of how a focus group is set up, and then how interviews are set up. But for the most part, the process of going through and identifying themes and patterns is going to be similar across both of them. Awesome. Any final questions before we wrap up?
Can you put the link in the chat, because my QR code is not working. It's taking me somewhere else to register for some other stuff. I see that begin survey.
Kelly, you asked questions to other trainings that I offer. I do lots through the PTTC, so there'll be one next week come up on April 22nd that's going to talk about reporting and whatnot. So I encourage you to attend those. And yes, I do work with coalitions directly, so I drop my email in the chat and prevention providers to help with evaluation needs. So if you're interested, I'd be happy to help you. I know the PTTC also provides some of that support as well, so you can reach out that way as well. And I have a number of different toolkits and trainings available on my website as well. So you can check out commongoodData.com, blogs. There's a section up at the top that says toolkits that you can see as well to provide more information on evaluation work.
Thank you so much, Drew. Again, thank you all for attending today's webinar. We hope to see you next week, and I hope you have a great rest of the day. If you have any additional questions, please don't hesitate to reach out to us at the Southeast PTTC, and then you also have Drew's email as well. We look forward to seeing you next week. Have a great day. Thanks.